Hello and welcome to Incorporating Solutions into Your MPS Strategy, Healthcare Industry. I would like to introduce you to your first presenter for today. He is the Director Solutions and Services with InfoTrends, Mr. Randy Dazzo. Mr. Dazzo, you have the floor.
Great. Thank you very much, Gerald, and thank you, everyone, for joining us again today. Again, my name is Randy Dazzo, Director of Solutions and Services at InfoTrends. For those of you who do not know InfoTrends, we are a leading market research and consulting firm for the digital peripherals and solutions industries. Before I begin, I wanted to make sure that everyone has had a chance to take a look at the polling question and submit their answers. I'll go through that one more time with you. The polling question today, the first one is, which of the following are business priorities for your organization this year? And you can check all that apply. First answer is shifting paper-based processes to electronic digital processes, going green, environmental improvements, consolidating office equipment, improving document security, better document search and discovery, improving regulatory compliance, better integration of employees' mobile devices for office productivity, or implementing a cloud-based solution. Again, you can select one or more than one of these as a priority and hit the submit button. We'll be closing out this polling session in a couple of seconds, and I think, Gerald, I believe we can probably just close that out. Okay, so again, this webinar is called Incorporating Advanced Solutions into Your MPS Strategy for the Healthcare Industry. And the first thing that I typically go over when talking about managed print services is our definition of MPS. And management services, in our definition, is a services-led offering that helps companies solve their pain points, typically around the costs, management, and or document processes, by delivering continuous improvements, particularly around an organization's document and output environments. And I've highlighted two areas within our definition that are very important, which are solving pain points. And again, a lot of pain points around MPS traditionally start out around cost and the management of devices as it relates to hard copy and output. But it also can be related to the document processes that are within the organization that also have to do with documents. And I also talk about continuous improvements a lot because MPS isn't just a one-time event, or you don't go through an MPS assessment and optimization at the very beginning. It actually is a combination of a series of events that really should be a continuous improvement throughout your organization, throughout the entire managed print services engagement that you have with your provider. So those are two important points I wanted to point out for you, and they're particularly important when we talk about some of the solutions and advanced services that we're going to be talking about in this presentation today. Now, the way that we actually break up the managed print services in one of the segmentations that we look at these three types of engagements. The supplies, break, fix engagement that really focuses on just really shifting from a traditional, paying for supplies and paying for break, fix to a contracted managed supplies engagement. The next engagement is really around the hardware and optimization and optimizing the devices within the organization. Now, there is typically a supplies and a break-fix component of MPS in that as well. But again, the focus is around optimizing the hardware infrastructure, again, to help lower your costs and improve, those aspects of both hardware, supplies, and also the servicing. And the last segment, which I call enhanced engagements, that also do include a supplies and hardware component, but they also do include other types of enhanced solutions, such as managed document services, workflow services, security, change management, a bunch of other different enhanced solutions that not only look at it from the hard cost of output and hard copy, but also look at it from some of the other advanced solutions that can also help to optimize your organization from a business process standpoint as well. The next thing I want to talk to you about is some research that we've done at InfoTrends, and we've actually done quite a bit of research in the healthcare industry. One of the research studies that we completed was at the end of last year that looked at a bunch of different vertical markets, one of them being the healthcare industry. we actually focused in on the education, financial services, legal, and the healthcare markets, which are truly the most paper-intensive vertical markets that we've been seeing in the industry. And with this survey, we interviewed between 75 and 120 businesses within each of these vertical markets to really understand the adoption of solutions and services as well as managed print services within each of these different markets. The criteria was that they had to be within either the IT department or also, a decision maker within the organization. We also want to understand some of the printing habits, the scanning workflow habits of the end users, as well as we had broken it down into different company sizes within these vertical markets as well. Just to give you an idea of the U.S. healthcare industry in the U.S., there are more than 700,000 healthcare establishments today, and they really range in these different areas, the largest being the ambulatory healthcare services. Then it goes down into the office of physicians, office of dentists, and then other types of health practitioners. And then lastly, hospitals. Even though hospitals seems to be the smallest in the amount of establishments, there are definitely a lot of processes and devices that are sold into the hospital industry as well. Just want to make that point to you. One of the questions that we asked in this particular survey was, which of the following business priorities did you have this year? And it was actually the same question that we asked at the beginning of this presentation in the polling question. And this is the results from this particular survey between all the different markets, which is the total side, and then in particular, specifically the healthcare market that's on the right-hand side. And if you look at the healthcare market, you can see that the same as the total, the largest response was in shifting paper-based processes to electronic digital processes. It seems to be a trend that happens with all of these different paper-intensive industries, but more so in the healthcare industry probably because there is a lot of paper that's still within a lot of these organizations, as well as there's a lot of activity going on from stimulus that's happening within this industry, and really shifting these processes from paper to electronic. The second was around improving document security, and of course, with that, we also see things around improving regulatory compliance. They must go hand in hand because a lot of the initiatives within regulatory compliance in the healthcare industry happens to revolve around security and securing, information about, say, patient records. Another initiative was the third initiative that was one of the top was going green, or environmental improvements. Again, probably because they do want to shift, or this industry does want to shift to more electronic digital processes and become more green. But at the same time, we do see there's this cost reduction that also goes hand in hand with going green at the same time too, where if you're using less paper, you're also spending less from a cost standpoint on hard copy output. Lastly, the last of the top five was consolidating office equipment, and that's where managed print services really comes into effect from the management of devices as well as the costs around them, and really wanting to understand and create more visibility in the device as well as hard copy environment to be able to consolidate office equipment, because, again, there is a lot of paper that is being used. And that's where we come to some of the trends and challenges that we see in the healthcare industry in general. And probably this looks like many of the offices that you're either in today or your customers that have lots of records that contain lots of paper. So paper definitely is still being used in the healthcare industry. A lot of it is being used, although we are seeing a huge transition in the marketplace to shift from this paper-based process to digital. And of course, the stimulus funding that goes around this is helping to change that, because the government wants more visibility in the healthcare industry to be able to pay things around Medicare and things like that. But again, we do see that there is a lot of paper beyond just the patient records in the healthcare industry as well. The other thing that we're seeing quite often is that faxing still is very common in healthcare. I was talking about this morning, where we do see still a lot of faxing going back and forth between healthcare practitioners as well as healthcare practitioners in hospitals. Transcriptions is still another area that still occurs quite a bit. And, of course, there's a lot of notes that are being, used in gathering information about patients, taking a lot of these notes by either the doctor or the nurses, as well as getting vitals and information about patients, that is still paper-based and used in many healthcare organizations or in hospitals and things like that. Another big area that we're seeing a lot of paper and manual processes are in the orders that are being prescribed by either doctors, mostly by the doctors, but still being created in a manual fashion, written on paper. And one of the things that we've been talking about at InfoTrends is that wherever there is paper within any of these processes, one, it poses a risk of information from a compliance and security standpoint, as well as that it's not very efficient in the way that information is being handled within the healthcare industry. So, and again, we definitely see a lot of processes still occurring, even though that there's this shift that's going on to digital. Hard copy paper, again, is still, an analog, based process. We do see a lot of those processes. Hard copy paper, again, as I mentioned before, it poses a lot of risk from a compliance standpoint. It can get lost, misfiled. It's a very unsecure means of managing information. And again, as I mentioned before, it does not meet compliance initiatives, and it's not very green. And, of course, it also increases costs around the healthcare industry. So what can we do to implement the right solutions to help in a lot of these healthcare market challenges? And if you go back to the top initiatives, you really have to ask the questions to yourselves if you are a healthcare or within the healthcare industry around going digital. What is your strategy in transforming these paper-based processes into digital processes? And we know that there's a lot of initiatives in doing that around patient records management and a lot of solutions that are being implemented today. But what we found is that there's still a lot of gaps between, the process of actually getting the hard copy information into these electronic, processes that still occurs in the industry. So I want to talk a little bit about that later on and kind of go through some of those processes with you. The next thing is around privacy and security. I mentioned before, are we aware of all the initiatives around patient privacy? And are we utilizing the measures to protect the customer's information? Now, what happens is that in a lot of cases that there are a lot of policies that are created within the healthcare industry around privacy and security, but what we're seeing is that upholding that privacy and security can be challenging, especially when there is still a lot of paper being utilized that has sensitive information about patients. The next thing is going green. How can you become more green with your devices and your infrastructure? We'll talk a little bit about that, as well as improving the costs and consolidating the equipment from a management services standpoint. From that standpoint of consolidating office equipment, do you have, an MPS strategy that helps you to analyze or at least give you the visibility of the devices that you have within your environment to make the right decisions on whether or not you need to optimize or how much paper actually is being utilized within the healthcare industry from a hard copy output or copying or printing perspective? And as I mentioned before, the regulatory compliance, are you really meeting those compliance initiatives, and are you utilizing the devices in order to meet those compliance initiatives within your organization? In the survey, we also asked whether or not these industries agreed with the following statements, and I won't go over every single one of these, but the ones that surprised me the most were this answer. My organization's document-related processes could be improved, could be improved. And we got an overwhelming response in the healthcare industry that they either neither disagreed or agreed, or they agreed that their document-related processes could be improved. There was nothing around strongly disagreeing, which is surprising, or that they really disagreed in general. There is no red or yellow here. And that really just goes to show that, even though they have possibly some related processes, they know that they could be improved by technology that's actually being deployed today. The other thing that was interesting to find out was that even though they have regulatory compliances and policies in place, they do lack the tools and technologies to uphold and enforce those policies. As I mentioned before, it's the same general thing. They either strongly agreed they either strongly agreed or, neither disagreed or agreed. But again, a good overwhelming response of people thought that, they didn't have or they weren't utilizing the tools to enforce, these policies. One of the questions that we also asked was, does your organization or firm, why does your organization or firm typically invest in these technologies? And you can see the differences between the total as well as healthcare in general. The areas that were interesting, of course, typically people invest in technology to increase company-wide productivity, and that was with the total as well. But we also saw that they definitely wanted to address the security requirements. That was the number 2. And then the number 3 was compliance issues. So, again, those 2 areas kind of go hand in hand, as I mentioned before, but they're a big concern or a reason why they're investing in technology in order to meet some of those basic initiatives. When we ask the question of which of the following departments or processes do you have interest in automating in the healthcare industry, again, probably the biggest and not so surprising is around customer records. And what that means is actually the patient records. And that really, goes to show all the initiatives that are happening around, taking those paper-based records of patients or customers in this particular question and turning those into, electronic processes or automated processes that can help streamline information within the industry. The next question that we asked was, what are your multifunction printing devices or copying devices used for? And what we typically see are the things that you see here. They're either used for printing, copying, which were the number 1 and 2, faxing, which I mentioned before. There's still a lot of faxing going on in the healthcare industry. That was the number 3. Those are very typical things that we see in the other industries as well. The one area that we see little traction in most industries, as well as in the healthcare industry, is in actually implementing workflows and taking these workflows to simplify or streamline or create efficiencies within organizations. We believe is an important area that the healthcare industry can take advantage of in filling in these gaps that are still paper-based and making sure that the information that you're collecting about patients is secure. So they kind of go hand in hand within workflow and security at the same time as well. And lastly, one of the questions that we asked was, please rate what you think your management knows about printing, copying, faxing, and scanning at your site. The one thing that really surprised us, again, in the healthcare industry was that a lot of people didn't realize that MFPs could be used for business workflow improvements. Either they didn't know, which is in black, they didn't have insight, which is almost 50% of the people didn't actually realize that these devices could be used for workflow processes. And then, there's a good percentage that actually had some insight, but still not a lot of people are probably utilizing these devices to help implement workflows to streamline processes and create a more secure environment. So if we look at the multifunction device, it really has turned into not just a printing and copying device, but really an information on-ramp and off-ramp into the electronic business process workflow within the healthcare organizations. It can really be utilized to get information into a lot of these healthcare repositories or into patient records management, as well as it can be utilized to securely get information out of those repositories and then into the right people's hands who, really need access to that information from a hard copy standpoint. So it does allow or give users that security management that's critical within the healthcare industry, as well as it does provide a smart workflow environment within healthcare. The New England Journal of Medicine actually did a time and motion examination to really look at what people are doing within the office, what doctors and nurses and people are doing within the office. And the doctors spend a good amount of time, believe it or not looking at patients, but doing things outside of really diagnosing patients or actually talking to patients, and which is probably their main job. They're doing a lot of things about returning phone calls, reading lab reports, examining consultant reports and imaging, sending emails. And again, these are considered, to them and to us, non-revenue generating areas for their business. And the response from the NCHIT organization said that, the electronic records in these types of processes, plus changes in the workflow in particular in payment, might help to solve some of these problems. We actually did a similar type of time and motion study in the healthcare industry, particularly around the clinical process in hospitals, to really look at whether or not all the gaps were being fulfilled with these initiatives that are happening for EMR and EHR systems. And the interesting thing is that, again, a lot of organizations, everyone within, healthcare has to, or those that want to actually get reimbursed for their systems, would have to do this by 2013. And we do see a lot of, these organizations moving towards that type of process, which is fantastic. Records are now being managed with an electronic filing system. The challenge that we saw with that, though, is that the processes that actually get a lot of the hard copy that's still being utilized in a lot of these processes aren't being looked at by these larger EMR, HER systems. So if you look at the diagnosis process, there's still a lot of written scripts for test labs. Results are typically faxed back with paper, again, not very secure from a paper-based standpoint. Doctors are sending orders to hospitals manually, sending paper-based orders to the hospitals about what they have to actually go into the hospital for. There's still dictation that goes on, physical dictation that about the patient's H&P information that's still taken down in a manual process on paper in some cases. And then a lot of patient history is also faxed at the same time. When it comes down to the pre-admittance process, that too is actually, there's still a lot of gaps with getting information into the system here. Receiving the booking orders from the doctors, are typically still paper-based. All the financial clearing that has to occur for a procedure to actually occur still is not electronic. The lab work and tests that are ordered by either admittance or that's being submitted by the doctors still are paper-based. Lab results sent back are paper-based. And then a physical paper-based chart in some cases are still created at that time. And then, eventually some of that is put into the EHR system, but a lot of the times there's still a physical document that goes around with the patient as well. Then when the procedure actually occurs, there's still procedural notes that are recorded, sometimes manually. There's doctor signatures, the dictation of how the actual procedure went and the process and the results is still being manually done in some cases on paper. Hard copy put into the records, by the doctors or the nurses and put into the patient's record during that admittance process to actually go into the hospital for staying, in bedside. And then from an inpatient standpoint, there's still a lot of paper-based processes where manual written orders that are produced by doctors. There's still a lot of doctors that are doing things manually or telling people to create manually on paper and then putting them into the EMR systems. That does still occur very often. Doctors' notes, the vitals, as I mentioned before, the daily lab results that occur, if they're not in the system already being transferred into the EMR system, sometimes those are still manually placed physically into the patient's records. And then the printing of all the daily nurses' orders that actually occur, again, sometimes printing still does occur there too, if it's not electronically based. And then lastly, from a discharge standpoint, the discharge orders, dietary planning, all the things that have to occur for the patient to actually leave the hospital, a lot of those types of notes and planning information is still being taken down manually from a paper-based standpoint, transferring planning orders, transferring all those things, medical prescriptions, medical file transfers from one hospital to another, sometimes are still physically paper-based if the hospitals aren't affiliated with each other, and a physical record still has to be sent over. And then, of course, coding and accounting, some of those processes are still paper-based and manual as well. So if you look at all those areas where we see gaps within the system, we feel that, again, a lot of the EMR systems aren't looking or taking into consideration those things that can occur from a workflow standpoint with these devices, and there's definitely a lot of opportunity to not only cut the cost of paper actually being utilized within each of these different processes, but at the same time can help with the security around the information that's important about the patient. So as I mentioned before, this going digital workflow solutions are critical, and you really have to take a look at all these different areas where you can find gaps within the healthcare industry. As I mentioned before, workflows can be used for patient records data, any of the manual orders. As I mentioned before, large amounts of manual written patient information still occurring in a lot of these processes today. workflow can also ensure the timely and accurate flow of this information when it goes from the doctor to, say, the pharmacy. These things can happen, instantaneously if they're done within a particular workflow process. They can streamline and simplify the processes, and it can also provide a print-on-demand type scenario that is used for materials that really are needed, especially from a hard copy standpoint. When, for instance, when a patient actually gets discharged for dietary suggestions, things like that. These workflows can be created even on the front panel of the device itself, where you can have a one-button execution that can definitely look at each of these individual workflows individually and really help to fill the gaps of these workflow processes into and out of these EMR systems. The other area that I mentioned before that's critical is securing confidential patient records and compliance. And, most of all the compliance initiatives that we see in a variety of different industries are around keeping confidential personal information secure. And security is really, of course, very important for the healthcare industry with, of course, HIPAA and the privacy of confidential information. And the amazing thing is that a lot of records about patients, really have to be secured not only from people from the outside that potentially could be trying to get information, but also within the hospital environment as well. Some nurses are in charge of particular patients and only should be able to see that patient's records or information. And by utilizing security methods around the MFP devices, you can create that secure process of only being able to access certain records if you're authorized to access those records. So there's definitely ways that you can secure the MFP. One is by an MFP secure access, by creating an authentication solution that allows the access to files or processes. That is actually also traceable and auditable by the user. So you can actually see, or the IT department or any of the officials within the organization can actually see who's been able to access the information or who's been trying to print information or even scan information to that fact, both ways, because you can secure it both from an output perspective as well as an input perspective. And then, of course, from a data security standpoint, you have things around the MFP that people don't even realize could be a potential threat to gathering particular patient record information, because the MFP device happens to be a peripheral that's attached to the entire IT network. And like any other peripheral device, even a PC or a laptop, you would think twice about securing those types of devices that allow you to access information. You have to take those security considerations with the MFP devices as well, because they do have access and do hold critical information within the hard drives of these particular devices. And then the information that flows in between these devices and also these repositories have to also be secured as well. So you have to have all the necessary networking solutions like IP filtering, destination restriction, things like that, to really help or prevent information that could be pulled or accessed through these devices. And again, just to reiterate, these are the different areas of the MFP that you can secure. Secure access. You can create PDF file encryption, creation, digital rights management that only allows for people to be able, or certain people to be able to access information that gets the authority to access PDF files, the hard drive overwrite, secure mailboxes, or authentication that only allows you to actually pull certain information, and lastly, that secure networking with IP filtering. As I mentioned before, too, that secure access solution is critical for both the input and output of secure information on the MFP, and really should be utilized with these MFP devices because they are shared typically among the network and typically among many people within the organization. These are installed on the MFP, which requires the users to authenticate either by a PIN code or swiping an access card onto this device. That really, again, creates the auditability because you know exactly who's utilizing that device by their PIN code access or by their swipe card, and then it tracks all the information that's either pulled or scanned on these devices. So You can look at it from an auditing standpoint later on, or you can, again, utilize it for, securing the MFP so information just doesn't get into the wrong hands. Then you have Going Green, cost recovery, and accounting solutions. They kind of go in hand with some of these secure access solutions, and it goes a little bit beyond, because now what you can start doing is recovering information, start tracking information by entering critical information, say, that can help with charging back, say, either individuals or departments within the hospitals or within, the healthcare industry, or even individuals being able to charge back patients for all the hard copy output as well as scanning in of information. And, of course, a lot of hospitals are looking at ways to recover different costs within the environment, and if they were able to at least understand what the printing environment or the scanning environment looks like from a patient standpoint, they can either charge specifically for those scans and prints, or they can just put it in as a cost that's associated with managing the patient within this healthcare environment. Because, again, lots of paper still is being utilized with every single patient record that goes around with that patient. So, and as well, if a patient gets discharged and paperwork does have to be submitted someplace else, sometimes there are binders and booklets that have to actually go out with the patient that someone has to take into consideration of being charged for. Either the hospital is going to consume that, or it can be charged to someone else. And this is one of the ways that you can actually look at being able to recover some of those costs for output within your organization. So if we look at the typical managed print services phases, we've broken it down into these 5 major areas where we have an assessment phase, which is probably one of the more critical phases within your MPS engagement. This is really where the person that's going to be implementing this MPS solution or services will look and understand what your pain points are within your organization. And every single MPS engagement should be tailored or customized to the specific pain points of your particular organization. So it could be around costs, which typically are the main reasons why people want to go into managed print services, and there's a lot of ways you can reduce those costs in the healthcare industry. But at the same time, it could be around things like incorporating business workflow solutions. And if that's a pain point that's critical for your organization, this is the time where either you should start thinking about it or talking to this provider that can help you with that particular pain point. They'll also typically go through a hardware supplies assessment and even do a walkthrough throughout the environment, just take a look at and make sure that they're covering all the different areas from both an output perspective and also an input perspective. They'll actually go into this presentation phase, give you a couple of recommendations on what you can do to improve either the costs or the processes. They'll implement the MPS solution or the service, and then they'll monitor that over time. And through this monitoring phase, they'll also look at different areas within the organization that can also be improved as well, not only from a cost standpoint, from hard copy and devices, but also from a business process optimization phase. I have this phase kind of in the side here, and this business process optimization phase can happen at any point in time during this process. So again, if it is a critical pain point within your organization at the very beginning, you would want to make sure that, again, that you bring that up with your provider. So in summary, just want to reiterate again, there's still a substantial amount of paper that is being utilized in the healthcare industry, and an MPS offering can help to reduce, the physical cost of paper, as well as create a more secure environment, as well as an efficient healthcare environment through some of the other advanced solutions that you'll hear more of today. So again, they can help with these paper-based workflow processes. They can help with the security, keeping confidential records secure, and meeting these compliance initiatives. They can help you to maintain a greener office environment by cutting paper out, as well as reducing those costs too. So what I want to do now is let's reveal the results of the first polling question. Gerald, let's serve that up. And again, the number one thing is we noticed in our results as well, in our survey, shifting to an electronic paper, from a paper-based process to an electronic was the number one at 91%. And then the second one, again, still very important, document security, and compliance, or improving document or regulatory compliance. So it's great to see that the results of the poll actually are equivalent to our results, and it's good to see that. What I want to do next is serve up the next polling question, and the next polling question is, what type of MPS or MFP solution are you interested in adopting for your healthcare organization? And the selections you can select are paper-based workflow solutions, secure access solutions, cost accounting recovery, green solutions, paper cost reduction solutions, or consolidating, optimizing office equipment. Again, you can select one or more than one. Check all that apply. We'll give you a couple of minutes to submit that, and we'll open up the questions for Q&A for my session right now. So why don't you select that and then hit the submit button. Gerald, we can close that out in about a minute or so during Q&A. Okay? So we got a couple of questions in here that are for me. There's a question here that actually asks, how much money are healthcare organizations saving by engaging in managed print services? That was actually also captured in the survey for people that are already engaged in managed print. And the average healthcare industry is saving between 25 and 30% of their output environment by going into an MPS engagement. And that just includes, the visible and also the actual hard copy of paper, supplies, the devices within that environment. They're saving around 25 to 30%. That doesn't include any of the advanced solutions that can also help to reduce some of that money as well. So there's also that can be taken into consideration, which are not as easy to see exactly how much they're saving from engaging in management services up front. But you can understand that there's a lot of benefits and efficiencies that can be created by by implementing some of these advanced solutions. So definitely want to make sure that those are also considered as well. Another question that came in is, do you recommend considering advanced solutions in the beginning of the MPS contract? And again, as I mentioned before, it really depends on what your pain points are. And I would say that if you're in the healthcare industry, you would want to carefully look at, obviously not only the cost, but also the other pain points that may revolve around the security of information and also creating the workflow solutions that help with the efficiencies that are still paper-based. So I would say definitely yes if, those are some of the critical things that your organization hasn't taken a look at yet. Really take a look at some of those things. I think that we probably closed the poll out by now. I want to make sure that I give David some time to do his presentation. Let's reveal the the results of the second polling question, if we can. And what types of solutions are you interested in doing? And the ones that we have that are the most are paper cost reduction, consolidation of office equipment with 60%. Security end is very important, followed by paper-based workflow being the fourth, interested area that people want to actually implement within their management services. So with that, what I want to do is pass it over to Dave McKenna. David is product manager for healthcare solutions for the office solutions. David?
Great. Well, thanks, Randy. And thanks to all of you for joining us here today. I think Randy did a fantastic job of outlining the specific trends in the healthcare industry with regards to needs for improved managed print services. What I'm going to do in my shorter part of the session here is give a couple of quick examples of how the document imaging solutions that are available can specifically address some of the more pressing needs that Randy highlighted. But before I get into that, I want to give a quick overview of who Nuance is and what our role is in the healthcare industry. Chances are you already know who Nuance is through our dictation or maybe our transcription products. With those speech-based solutions in almost 40% of U.S. hospitals and over 450,000 individual providers and over 10,000 healthcare institutions, Nuance really is a market leader, and the platforms that we're making available are really transforming the way clinical care is provided. But what a lot of you may not know is that we offer a broad suite of document imaging solutions, and that's what I'm going to be touching on today, really focusing on two of those, one for print management and the other for advanced scanning solutions. But let's get into the print management one first. So I don't think I need to explain why print management is important for healthcare. I think Randy already touched on that for us, and obviously cost is one of the biggest concerns. But just to ask some questions, if your healthcare organization is concerned about the security of patient-based records, and in fact that seemed to be number 2 in today's poll, and if you're concerned about documents with PHI being exposed in printer trays or recycling bins or long wait times, and of course the high cost of printing, then investing in a print management solution is probably worth a really close look for your organization. What Nuance offers is a platform called Equitrack, a print management solution that helps healthcare organizations improve profitability, reduce costs, improve their operational efficiency, meaning get the most out of their devices, and of course improve security and compliance. And at a high level, we really do this in 3 ways. One, we provide the ability to require authentication in order for any user to print or retrieve documents from any output device. And what this really does is it ensures that only the approved users are going to have access to your network resources, and then it also provides you with an audit trail in support of your compliance initiatives. 2, we're providing convenient and secure access to output wherever it's needed across your facility, because we're going to be able to leverage the same access control cards that are likely already in use at the hospital or care facility. And then 3, we're generating usage reports to provide a really deep understanding of the actual output volume and associated cost that the printing activity for the organization is generating, and then also giving the ability to dramatically reduce that output and the associated cost by implementing printing rules and routing capabilities. In fact, it's not uncommon at all for us to see healthcare customers that implement an Equitrack office system to see their volumes and costs drop by 30 or maybe sometimes even 40%. So how does it work? Well, first, all the security initiatives around your documents are going to start with knowing who printed what. And what Equitrack Office requires, again, is that all users authenticate themselves in order to access any of these devices, the MFPs or printers on your network. And this establishes a detailed record of who accessed which device and at what time. And once you know that, and you know who's printing the document, then you want to control where it gets printed. So what I want to walk through for you here real briefly is just a simple example of what we would call a secure document release example. And so in this instance, we have a nurse, and she needs to send an admittance form to be printed. And so what happens is that document is held in a secure server on the network until the point where the nurse walks up to the device, unlocks it using her ID card to pick up the forms. But now what if that device was busy? What if it was out of paper? What if it just simply wasn't working? Well, she could walk over to any other device on the network, scan her ID card there, and have the print job released. But Equitrack can actually take it a step further when it comes to security and convenience with what we call follow-you printing. So I want to give an example here. In this one, what we show is a lab technician who needs to securely deliver some test results, let's call them blood results, to coworkers across the different hospitals that he's supporting. And in this example, we're assuming it's a hospital, maybe an IDN with multiple hospitals and also associated clinics. So with follow-you printing, all the documents that he wants to be printed can be held in a secure print queue, just as in the last example, and then he can release the information to any desired printer at that hospital when the intended recipient swipes their access card. So he says this is going to Dr. Dunn, and Dr. Dunn walks up to that MFP, and when he does, he's able to download and print out the document that was intended just for him. And so we don't have sensitive information waiting there on the print tray. Or the lab technician could just as easily say, well, this needs to go to Dr. Yarrow, who's at another hospital location, and when Dr. Yarrow goes to the MFP in his location, he scans his card and it's made available. So I think it's very clear to see how this can help in terms of ensuring the security of the PHI on those records, but it also is going to reduce waste and control costs because you're not going to have printouts that aren't picked up waiting there and just wasting paper and wasting jobs and taking cycles. So let's talk a little bit more about reducing waste and controlling costs, because really, for a lot of healthcare organizations, the most compelling reason to consider a print management solution like Equitrack is that it gives the ability for you to really take back control of all the printing activity that's happening at your organization. What this means is when a job is printed, there's going to be rules and routing functions that look at, first, who the user is. Is it a nurse? Is it an administrator? Is it a physician, et cetera? And then a number of attributes that are associated with those print jobs. So, I mean, is this a 5-page print job? Is it a 100-page print job? Does it contain color? Is it one-sided or two-sided, et cetera? And then what Equitrack does is it compares those user profiles with the attributes of those specific print jobs, and then based on the print rules and routing that you have implemented into Five for your system, it will either allow the print job to go as requested, potentially convert it from a one-sided print job to two-sided, or potentially convert it from color to black and white, maybe even deny it, because if someone's saying, I want to send a 250-page color print job to the network printer down the hall that everyone uses, maybe that should be denied, or potentially redirected to a print shop. But what this really translates to is a system that allows you to automatically encourage, or if you choose, implement it so that you automatically enforce cost-effective print habits. And then you won't have people sending 200-page color print jobs to the network printer that everyone else wants to use. And Equitrack also offers a wide range of reports. There's standard reports and also customizable reports that allow you to review the costs of your print output by individual user, by user group, by department, and even by device or device type. And when you use these reports, what it lets you do is drill down on a long range of potential issues, and then that lets you kind of refine and change the print rules and routings that you've put in place so that you can continue to knock out costs in your print streams. You can even drill down on specific devices and figure out which devices are overused and which devices are underused, and decide how to redeploy those so that they're in best use, or potentially even consolidate those. But the end result really is the ability to effectively monitor and measure and manage your printing and output volumes, and by extension, have a dramatic impact on the print costs that your organization incurs. So what I just walked through there was a very high-level overview of how the Equitrack platform can improve access and strengthen compliance and improve security, while at the same time reducing printing costs and pushing waste out of the organization. What I want to do here now, though, is switch gears a little bit and speak to what Randy was talking about as the number one priority from today's survey and also his research, and that is in relation to document imaging for paper-based records, clinical records, that are coming into hospitals and clinics from outside the facility. So, for example, it's very common for a hospital to receive test results from a clinic that maybe is referring a patient to the hospital in the form of a fax, or they might even be hand-carried by the patient. And such a big percentage of this patient-based information is coming into these hospitals and clinics in paper form that it really leaves this big challenge, right? They want to shift their paper processes to electronic digital processes and fully take advantage of their EHR, but they've got this big gap. So what I want to focus on here is how to best integrate those paper records that are coming into the hospital or clinic into the EHR. And what we hear whenever we talk to healthcare companies in terms of scanning and paper-based records and getting those into systems, really the biggest complaints that we hear is that it's, one, expensive, and two, it's just plain cumbersome. And what we find is that healthcare organizations are usually trying to address this in two ways. In many instances, what we'll see is what we would call front office scanning solutions, which might be in smaller hospitals or clinics where they've got multiple desktop scanners that are in place, and then those require multiple manual steps to scan those documents, rename them, parse them, store them as an image file in a network folder or document management system, and then eventually get those linked, hopefully, to the EHR. What's also very common, especially common in larger hospitals, is to find dedicated back-end, or what we would call batch scanning solutions. Oftentimes this is a scanning department. Might either be in the basement, or maybe it's even a service that's provided where a van comes by the hospital once or twice a day, picks up all the paper that needs to be scanned, takes it back to their facility, scans it, and then it eventually gets back into the system. So these kinds of batch processing scanning solutions are very costly, and while they are effective if your goal is simply to archive all of your documents, they really can cause a very significant delay in the time it takes from when those documents were initially made available and when they came into the hospital or clinic from the time that they're actually available for viewing in the EHR. So if the goal really is to give easy access to all patient information and patient records, including those that originated on paper in the EHR, then we need to remove those bottlenecks. And what we can provide is an ad hoc scanning solution through the shared network resources, like these multifunction peripherals, that are already on the networks in very high numbers. And what that will make it do is get you into a position where you can have quick and easy scanning of those documents from anywhere inside the healthcare organization directly into your EHR. Because ultimately, the physicians don't want to spend a lot of time managing paper. They would rather spend that time speaking with the patients themselves. They already feel a time crunch when it comes to that. So the eCopy ShareScan platform from Nuance can help make that a reality. And what ShareScan does is it ties the devices that are already on your network, meaning your MFPs, into the systems that your organization already runs on, like your electronic health record system, maybe your document management system from Microsoft, SharePoint, maybe Documentum from EMC, content management systems from OpenText, etc. But what makes eCopy unique is that it can collapse a multi-step scanning workflow into a few simple button presses on a readily accessible device, again, your MFP. And the interface that's offered there is very easy and intuitive. Really, it's as easy to use as what you'd find on a new smartphone. So let's take a look at what that might actually look like in practice. So in this example, we show how paper forms that would be coming in from outside the hospital, maybe test results or consult notes, can be easily and quickly scanned into the EHR. So to start the process, the user, and it could be a front desk worker, it could be a medical assistant, a nurse, or even a physician, scans an ID card and enters their credentials in order to track their scanning activity and produce an audit trail to support compliance. But once authorized, the user is going to place the document in the MFP tray for scanning, follow a few simple prompts through the simple and easy-to-use ShareScan touchscreen user interface, and on this next slide, I want to show exactly what that looks like. So what would happen here in the first step is that the user is going to select their desired workflow. And maybe they want to say, I've got test results here. I'm going to collect the test result workflow. Or no, these are consult notes. I want to launch that. No, these are historic notes. So they can select whichever button launches the workflow that they want to get into the system. And it's worth noting that the workflows we can present there are going to be customized based on the user's profile, so that the physician might see a different set of workflows than an administrative worker. But once they've selected that desired workflow, the document's going to be scanned, presented to the user on the screen so it can be validated and make sure it wasn't scanned upside down, as an example. And then they will be prompted to look that patient up in the EHR through a lookup. And they might also be asked to give a medical record number, tell us what kind of document or form type it is, and they can do that from a drop-down menu, and give us other information that might want to be used for file naming. And all of that can be passed along with the image as metadata to the electronic health record system. So what happens is ShareScan then OCRs, and OCR is optical character recognition, so that means we take the scanned image, run it through an OCR engine, and convert it to usable text. And then we sort, index, and name the files by document type, patient name, date, or any other indexing fields that were required. And what's going to happen is the patient record is passed over to the EHR as a logically named searchable PDF file associated with that patient. Now, for any of you that have systems that support it, we can also pass the PDF wrapped up as a standard level 1 HL7 CDA, or HL7 clinical document architecture file. So if you're using or if you're planning to use the latest HL7 standards for document sharing between clinical systems, we can support that too with ShareScan. Either way, the result is that the provider can now look up the test results for that patient in the EHR that had come in paper form either before or during that patient record. And hopefully that means that they're not going to miss some critical piece of information because that piece of paper was waiting to be scanned by a dedicated scanning group either off-site or down in the basement at the hospital. So the main takeaway here is that by making it quick and easy to scan those documents at MFPs anywhere in the hospital, we can dramatically accelerate how long it takes to get that paper-based information into the EHR. And remember, because we're requiring authentication at the MSP, we're going to ensure that only approved users actually have access to these workflows. And the end result, again, is that your providers are going to spend less time looking for patient information that's paper-based and more time working with their patients and getting that information out of the EHR. So that about wraps up my part of today's session on the two product overviews, and I hope shows how Nuance's document imaging solutions can help providers deliver both higher quality care but also lower costs by improving document workflows, making it easier to get access and make your information more usable, whether administrative or clinical, tightening the document security initiatives you have and helping support your HIPAA compliance initiatives, and really finally just eliminating wasteful printing and copying, largely through the implementation of a Equitrack Office system. So we have these solutions already in place with well over 1,000 healthcare customers. A lot of them are companies you would know by name, like Johns Hopkins, Mass General, Memorial Sloan Kettering, the Mayo Clinic, etc. And if you're having challenges related to any of these issues, whether it's processing of clinical documents, controlling costs, maintaining document security, etc., we'd really enjoy the opportunity to speak with you directly and find out what we can do to help you meet your specific needs. But I think at this point, what I'll do is see if we can open it up for questions. And I can actually see the questions here in my inbox. So we have a question that says, what did you mean by searchable PDF? Searchable PDF is just a different form of a PDF. Everyone knows what a PDF is, but searchable PDF means that the original file that was scanned was converted using optical character recognition so that what's left now is actually the text inside that PDF, and so you can actually type a name in or a term like Dave McCanna, and it'll find all the instances of Dave McCanna within that document. We had another question here. You showed scanning directly to the EHR from an MFP. What is the format of the file that is passed over? Does it follow HL7 standards? Well, so I mentioned that. So we can pass over a PDF along with some XML, which could be used to get the file to the right place inside a document repository or an EHR, but we can definitely support the latest HL7 standards. So if your system can consume an HL7 CDA, then we can pass over a document in that manner, and that's going to make it able to be passed along to other entities that might be associated with your EHR that you want to share that document with as well. So, Gerald, we're right up against the hour. I don't know if we want to take any additional questions or... Okay, yeah, there was one more question here that I think we can address. They said, we have a lot of different copiers and MFPs on our campus. Can your solution work with more than one brand of copier? So, yes, we actually can work with about 1,500 different types of MFPs out there. So regardless of the infrastructure that you're already invested with, you would be able to use the ShareScan and the Equitrack platforms across those. Okay, Gerald, I think I'll pass it back to you.
Okay, sir. Thank you very much. Ladies and gentlemen, this concludes today's presentation. You may now disconnect your lines. Thank you, and have a great day.